Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
In the previous videotape, we saw how to fit the master gutta percha cone. Now that that's done, we're ready to do the actual filling, which is the final step in our endodontic treatment. Before showing you the patient, let's go to some graphics and show you exactly what happens on the inside during this filling procedure. Here's the central incisor with the master gutta percha cone in place. Now, our problem is to fill up all of this additional root canal space, completely obliterate it, and to provide as near a perfect seal as possible. Now, the way that we do this is that we come across into the access cavity with an instrument called a gutta percha spreader. We push it straight down. The direction of force is vertical, straight down the long axis of the tooth. The term lateral condensation is actually a misnomer. We're actually condensing vertically, but the shape of the spreader actually forces the gutta percha over against the wall just by its actual shape. We're forcing right down alongside the gutta percha. Then we come straight out, and in that space that we've created with the gutta percha spreader, we take another gutta percha cone and kind of feed it into that space, and then we continue on. We put the gutta percha spreader in, and that creates another space. Then we take it out and insert another accessory gutta percha cone and keep on doing that, condensing straight down the long axis of the tooth, and by doing that, forcing the gutta percha laterally, making space, and then putting accessory cones in until the whole pulp chamber is completely filled. Any little voids along the accessory cones or between the cones and the wall will be taken up by a root canal sealer. Now let me go to a tooth that's been sectioned and show you the way gutta percha actually looks in a tooth. Here's the tooth and the master gutta percha cone. This is a maxillary central incisor that I've cut off to show you how gutta percha spreads and fills up the canal. Now, in the actual case, I would have put sealer all around here to fill up any small voids, but I wanted to leave the sealer out, as I did in the graphics, to show you what the gutta percha actually does. So here's my spreader. And I come in from the occlusal access and I push straight down. And then I turn sideways to free it from the gutta percha. And you notice that the gutta percha cone is now off to one side. So I come in with an accessory cone, put it into the space that I just made, and I'll cut that off in a second after I condense it. And I push straight down again. You really put some force on this because you really want to fill up those spaces. So let me take this out and cut this accessory cone off so you can see what it looks like. Get it out of the way. Now we have 2 points in. So we'll come in and see the space that I made with my spreader. So I stick the another point in there. Come in with my spreader, push straight down, and that's going to force it off to the side just by pushing straight down. Free it up. I'll cut it off so you can see. And we keep on going on this until the whole thing is filled up. As you can see, we're starting to close up more and more of the tooth. Push straight down, free it up. Here we are with the tooth completely filled. You can see the master gutta percha cone right about right here. And you can see it hasn't really changed volume. It's still the same size, but we've enabled it to change shape by the condensation. So it flows into the irregularities of the preparation. and all the accessory cones are put in to fill up the additional space. So we now have a nice, solid, dense fill. As I said before, sealer would be filling any tiny little voids to make this as much of a hermetic seal as we can. We've talked about lateral condensation of gutta percha. Now let me show you the actual technique on a real case. Here's your sterile towel kit, the way we normally have it, all of your proper instruments. Now, since we're finished with most of these instruments and we're not going to use them during the filling procedure after the master cone is fit, we put them off to the side. I've taken my accessory cones and my master gutta percha cone and taken them out of the Zephyrin, dried them off, and laid them along here. Here are the accessory cones along here. Here is the master gutta percha cone. They're all in line so I can use them really rather quickly. Now I'm going to be using my cotton forceps, so it's off over here. And then I have my sterile mixing setup, which I've already packaged and had sterilized and keep separately. So I open that up and take out the instruments that I'll be using. Take out my spatula. And be careful, you don't want to touch them with your hands because then they won't be sterile. Take out my mixing slab and my 3A spreader. Now this is the spreader that we were talking about in the graphics. And you can see it's a long, thin instrument. I have a PCA stop on it, and I'll show you why when we're filling. And also you can see that the accessory cones match the shape and size of this spreader. So we'll be using this. So we put this in the area that we will, so that it, area so it's close so we can get to it. And now I want to show you mixing the cement to the proper consistency. Let me lower this down and we can come in and I'll show you how we do that. We have the sterile glass slab. And this is the way I set things up so that the instruments that I'll be using will be the ones that'll be real close. Now we'll take a drop of the cement. As you know from lecture, this is a modified zinc oxide and eugenol cement. So I put 2 drops on my slab. 2 drops is more than enough to fill almost any one tooth. And I'll take some cement out, some powder, with my sterile spatula, and put enough out so you don't have to go back into your jar once you start to mix. And I'll start to mix. Now you don't have to worry about setting time on this because this material takes quite a long time to set. So you can mix it up, and when you're ready you don't have to work yourself to death getting it in the tooth because it'll take a little while. Now there are essentially 2 or 3 tests that we use to determine whether this is the proper consistency. Let me add some more powder. One is that it has to be thick enough so that I can pull it off to the side and it will stretch an inch and not break, and yet thin enough that I can lift it an inch off the glass slab. Let me lift this up a little bit. I can get to it. And the cement will be the proper, you can lift it off an inch and it'll still maintain integrity. So you keep on incorporating powder, and mix it out, and really apply pressure to this because we want to get these particles all dissolved in, the particles of powder, so it'll be a nice, creamy, and smooth mix. As you can see, you don't really need a lot because most of the area that we have we want to take up by gutta percha. So you don't need a whole bunch of sealer just to take up the very little bit of spaces. So we'll come along, just keep on mixing, spreading it out, making sure those particles are dissolved in. As I said before, there's no rush. It's getting to be the consistency that I like. So I'll test it. pull it up into a pile like this, dip in, and it comes just about an inch. I can make it come just about an inch. Let's try the other test. See how that holds together? There. So that's pretty good. It's nice and creamy. Now the last test that I use is I take the file that I'm going to put the cement into the tooth with. There are lots of things that you can use to put cement into a tooth. I use a file at least one size smaller than the last size that I used for the tooth. I took the tooth out to a 50, so I will use, this is a 40 file, I could use a 45. But I'll just take it and put some sealer on the file and then hold it up. Now, if that had just run down the file, that would be too thin. But you see how it kind of stays in one place? There's kind of blobs there. It flows a little bit, but not very much. That's my final test. So we have the test of being able to string out an inch to the side, and hold on the file. And I know that my sealer is ready. Now, this has a working time of quite a long time. You can work with this for a half an hour or almost even an hour sometimes. So you don't have to worry about rushing to get things done. Take your time, put enough sealer in, and everything will be fine. Okay, let's go to the tooth and fill it up. The sealer has been mixed and is ready. We've set up the master cone and taken out the accessory cones. The tooth is dry and ready, so it's time to fill the canal. Now I'm going to put some sealer in the tooth, and I do this, the tooth has been instrumented out to a number 50 file. I'm going to use a number 40 to put the sealer in, and I use about this much on the file and put it in a little bit short of length, our working length, and come around, paint the walls of the chamber and the root canal. The idea is just to coat the walls, kind of turn it counterclockwise to spin the sealer off inside the canal. I'm going to use 2 more files full. Here's another one into the canal. This sealer just serves to take up a little bit of the spaces in between the cones that I'll be using. And 1 more file full. And into the cavity preparation. Kind of go counterclockwise, paint all the walls so we kind of have a nice coating. There. I'll put that into the sterile towel kit and pick up my master cone and coat that with sealer on the apical 2/3. Have about that much sealer on the point and goes right on down to our reference point. Won't go any farther. Okay, now that's in place. Now we take the spreader and go right down alongside of the master Gutta Percha cone. Now I'm not going to push laterally at all. I push straight down. Have my finger on, let's see, move the patient a little bit. Have my finger right on the head of the spreader and push straight down. That's all I'll do to condense that. Now, to get the spreader out, I'll move it a little bit sideways, but I'm doing this very passively. And then I'll pull the spreader out. Right. Now, if you can see down that canal, let's see if the patient can move a little bit. I've moved that Gutta Percha cone over slightly to the side. It was right in the middle. And I did that just by pushing vertically straight down the canal. Now I'll take an accessory cone and put it into the space that I've made, right alongside. Goes down as far as it will go. And then I'll take the spreader with my finger on the head of the spreader and push down right alongside. Okay, that's all I have to do is push straight in. Then to loosen it so the gutta percha doesn't come out with a spreader, I twist it passively and then pull the spreader out. And we keep on going until the whole thing is filled up. Get another accessory cone, put it in as far as it'll go, right down into the space that we created with the spreader. Take the spreader, come in right alongside, push straight down with nice positive vertical pressure. That's it. Now turn it passively and take the spreader out. Remember, I'm only turning that spreader to loosen it up from the gutta percha. I'm not doing any condensation. Now you see how that accessory cone goes in not quite as far. I'm kind of working from the inside out, filling this whole canal up. Push straight down. Just the shape of this spreader is all it takes to force that gutta percha laterally. No lateral, I don't put any lateral force on it. Okay, now this one, I didn't get into the hole and it bent. You see how, see what happened? If you don't line these up properly, you won't get into the hole that you made with the spreader and they'll bend and you won't be able to use it. That's why we put out so many extras. So let me redefine the hole with my spreader. There we go. And take it out. And get another cone. There, that one went in. It takes a little practice to line these up properly. There. Push straight down. Now my spreader's hardly going in very far at all. It's only going in about 4 millimeters. Probably one more cone is all it'll take, and this tooth will be filled. Kind of work in one direction, get it all filled up. Yeah, that one went in, but not very far. I'll condense that one, and that'll do it. There we go. Okay, now it's nice and solid. Let me get it loose, and the spreader is just going into the tooth, not quite as far as the clamp. So I've filled up the canal, and all I'm doing now is filling up the pulp chamber. So now the whole canal is filled. We have all this excess gutta percha to get rid of. We want to clean out the pulp chamber all the way down to the cervix of the tooth. The way that I'll do that, a very quick and easy way, is to heat up the flat end of the plastic instrument in your Bunsen burner and sear these off. That just takes away some of the excess. Then I'll take the Wesco plugger and I'll heat that up. Get it nice and warm, but make sure when you do this, you get it inside the tooth and not touch the patient's lip. And you just come on down and push it straight down into the pulp chamber. And you'll take out all the excess gutta percha that's in the pulp chamber. I'll come around with the other end, which is cool, and kind of tap the rest, any loose gutta percha, and seal her down. I'm going to compress it. Make sure it's nice and dense. And then I'll go back with Xylol and spoon excavators to completely clean this pulp chamber. If you leave any gutta percha or sealer in the pulp chamber, then you might discolor the tooth. So I make sure that this is entirely clean, and then I go on. If there's no other defect, I'll restore the tooth with a composite. If it needs a crown, I'll tell the patient and just seal this up with crown and bridge cement or Cavit. So we'll clean the pulp chamber up, and then we'll go and take the final, or clean it up, actually take off the clamp, and go and take the final radiograph. All right, now I'm real pleased with this result. As you can see in the apical region, the solid filling stops about a millimeter, a half a millimeter short of the apex. We did put a little bit of sealer out into the periapical region. Now that happens sometimes. As long as it's sealer, you know that you have a good stop and a good seal. Then the body of the canal is well filled. There are no voids. You can see that it takes up the entire flare that we prepared into the tooth. The pulp chamber is clean. You can see that there's no gutta percha in there, right down to the cervix of the tooth, and the cavity is in place. So we're ready to release our patient. Now, before you release the patient, you want to make sure that you warn them that they do need a permanent restoration in any tooth that we do endodontics on. In this case, it would just be more or less a plastic restoration in the lingual of the tooth, but some teeth will need crowns, and you'll have to talk to the patients about that, especially if you're not going to do the restoration. You'll want to warn them. Also, you might mention that they might have a little bit of pain or sensitivity to the tooth, and that's normal after a filling for a few days up to a week. Other than that, you're done with the case. Hopefully it turned out as well as this, and if you have any problems along the way, feel free to ask an instructor to help you out.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.